All right, I call to order.
Sincerely sorry.
Okay, good. And I'm going to call the meeting to order. Ms. Hathorn, could we have the roll call, please?
Dr. Moore,
Present.
Dr. Robinette. Here. Dr. DeGuzman. Here. Ms. DeWitt. Here. Mr. Adamson.
Here.
Mr. Griffith.
Here.
Ms. Johnson. Here.
Okay, so we have a quorum established. Additions and adoptions to the agenda. Are there any additions or modifications to the agenda? I would like to announce that we'd like to remove the sewage nuisance at 3554 Rockview Drive from new business because it has been abated. Okay, could I get a motion and a second to adopt the agenda as modified?
So moved.
Second.
And all in favor?
Aye.
All opposed? Okay, motion carries. All right, approval of last minutes, meeting minutes from December 18th. Are there any additions or modifications after you've reviewed? Hearing none, can I have a motion and a second to adopt the minutes from last meeting?
So moved. Second.
Okay, could I get a vote for approving the minutes?
Aye.
Aye.
Okay, opposed? Okay, motion carries. Public comments. We're at that point where we're asking for public comments, and I don't see any public, so we do not have any public comments.
Do we
Okay.
want to take this opportunity to say hi to Larry?
Hi, Larry.
Hi, Larry.
So Larry Ricketts is our liaison from the City Commission that's going to be attending board meetings. Larry, do you want to say hi and tell folks about yourself?
Well, obviously, just took office January 2nd, had our first meeting on that Tuesday night. I'm very interested in, as far as the health department and your board goes this year, I'm very interested in helping to push through some increased penalties for the vaping places that sell to minors, and to maybe work on some other things. I'm very much opposed to the vaping stations and places that we have around the city. And I'd like to be able to do something about that. And we've, a presentation was made last fall by one of the staff members, and I was absolutely appalled when she brought in the box with the vaping things, and it looked like she was bringing in a box of candy.
Mhm.
And I really took an interest in that. So that's just something I'd like to work with you on this next year.
Okay.
So thank you.
Thank you.
Welcome.
Old business. Construction and demolition. Oh, okay. Demolition. Debris license. Ms. Zibby.
Thank you. So last month, you guys tabled the request from the Springfield landfill for approval for a license to operate in 2026. Since that time, the EPA has completed their review of the application packet and provided comments of items to address. We're waiting on Springfield landfill to address any of those comments. So tonight, we're again just asking you to, or recommending that you table your decision regarding the Springfield landfill until we have updated information from Springfield landfill. I can't talk either.
I know.
Rubbing off. And their application for a 2026 construction demolition debris license.
So we're asking for a motion and a second to table the approval of the 2026 license for the Springfield landfill. And we are also recognizing that they may continue to operate under their existing license until the board takes further action for them. And can I have a motion?
So move. Second.
Are there any questions?
I do have a question. How long would we wait for them to respond before we make a decision?
So far, in the last, probably about a year, I would say.
Yeah.
9 months maybe. They've been working with a consultant and have been very responsive. So I don't foresee them not doing anything. I would say if we don't hear anything for a few months, then at that point, we would bring it before the board and recommend doing something different.
It's kind of a case-by-case basis. There's nothing in statute that says you may only do this for X number of months before you make a decision. Like Zoe said, they're being responsive. We're seeing progress. There's nothing of a concern in their application packet that's like an immediate danger to life and safety. So we just kind of weigh all the variables and give our recommendations.
That's kind of where I was, are they
Yes.
just stalling and operating? and
No.
doing something? Yeah.
We've had experience with some of those too, but this is not one of those situations.
Okay, so, we got a motion and a second. Do a vote? Roll call. Please have the word.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette.
Yes. Okay, motion carried. New business. Sewage variance.
Thank you.
in the city.
All right, so 4360 Grange Hall Road is a property with a discharging aerator system, septic system. During our initial inspection in December, it was found that the system did not have chlorine in. It has yet to be added as of just earlier this week, yesterday, I believe. So we're requesting that the board declare the property at 4360 Grange Hall Road a public health nuisance. Am I doing the next one? Okay.
Yes.
The next one is 745 Northampton Road. Same thing, a aerator discharging septic system. We did our initial inspection in November there, and it was found that the motor was not operating, and the motor is still not operating. So tonight we're requesting to declare the property at 745 Northampton Road a public health nuisance.
So we're asking for a motion and second to declare a public health nuisance at 4360 Grange Hall Road and 745 Northampton Road.
So moved. Second.
Any questions? Ms. Hackathorn, can we have the roll call, please?
Dr. DeGuzman,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Mr. Adamson.
Yes.
Okay, motion carried. Have grant submissions, Mr. Cook.
Did anybody else notice that it's not the Zibby show for the rest of the
Yes.
I hope so.
Good.
All right, we've got a handful of grants to go through here. I'll talk about the first three and then Grace will talk about the last one. The first one, emergency preparedness grant. This is not new. We've actually been receiving this grant since 2002. So this was a CDC grant that started really in response for local health departments to the events of 9/11. And so this year it is level funding, which we're grateful for given everything at the federal government for the emergency preparedness grant, a little under $105,000. The grant period is a 12-month cycle. It is 7/1 through 6/30 of 27. So it doesn't begin, we're applying now in anticipation of the grant date starting July 1st. There's a little summary there, talks about just allows us to strengthen our ability to respond to both man-made and natural disasters. Again, it's $105,000, doesn't cover the entire cost of operating that program, but like many of our grants, we subsidize in other areas. So that's the first grant. The second one that I'll talk about is the Care Portal requesting agency enrollment. So if you recall last month, I talked about how excited we all were about the possibility of entering into Care Portal as a agency that puts requests in on behalf of needy families and kids. And there's a price tag with it. And I said, our goal is to find somebody to fund at about $6,000 a year to be able to do that. And we are putting a request in to the Wilson Sheehan Foundation. I will jump ahead and tell you that they've already agreed to it and we have a funding agreement. So very appreciative to the Wilson Sheehan Foundation for providing that first year of enrollment. So we're going to be rolling that out very soon. I know folks on this side of the room are super excited about that. And the third one that I will talk about is a request to the United Way's Springfield Unity Fund. This is a small bucket of money that they have to help address a lot of different things in our community. It was really created after the fall of 2024 in response to some of the needs of our agencies in the community. They funded us once. They funded part of our, when we were going to have our Burnett Road Clinic, they provided about $20,000 towards IT infrastructure. Unfortunately, you know what happened with the Burnett Road Clinic, but we are making an ask to them for $2,500 to take care of some patients that we have who have extraordinary social service needs. Think of it as our own little care portal. The $2,500 to be able to provide some of those services as we're managing some of these folks to provide them a good start back reintegrating into the community. And those are the first three, and I'll let Gracie talk about the last one.
Yeah, so the last one is the Community Health Foundation grant. So this is for their regular responsive grant cycle, not the health opportunity grants that Chris talked about a couple months ago. But there are two that we apply for in this cycle, and there are two that we have gotten for the past several years. So we're very thankful to the Community Health Foundation to continue their support with these two programs. The first one is to support our sexual health and wellness clinic. We're asking for $20,000 specifically to help offset some of the cost of the jail services that we provide. We go into the jail on Tuesdays and then provide the sexual health and wellness clinic services to people there. So that is for that one. And then the second one is for Start Strong, specifically to help fund our Start Strong Coalition coordinator, Anne-Marie Smearshall. She has been in that position since 2022, and she does a great job. So we asked for $15,000 for continued support, so she can continue to do the good work that she does.
Thank you. So we have a motion before you to accept these grants and creating new funds as necessary. Can I get a motion in a second, please?
Second.
Questions?
So I have a question, Chris, on this, on the United Way, on that grant for $2,500. What, it's a small grant, it's kind of a micro grant. Is that the amount? No, I mean, I'm guessing our need may exceed that amount or not.
Oh, sure. Yeah.
Okay, so it's,
Yeah, this is to just have this small pot of money that we can draw on.
Okay.
It'll go pretty quick.
yeah,
With
because
some of these-
I read what it's used for, and it's, yeah, I could see that going with just a matter of a few.
Yeah. Had some conversations with folks in United Way and appropriately at making the ask for what they would consider.
Okay, thank you.
Who's eligible for that one? That's just for people that come into the health department?
Yeah, anybody that we're case managing that we
Oh,
find
okay.
have some social determinants of health that need addressed.
Any additional questions? Ms. Hackett?
Ms. Johnson,
Yes.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay, we have an authorization to sell obsolete
We just
items
need to start
on
over.
on gum deals. Mr. Cook?
This is, if you've been on the board for a while, you may or may not recall, we do this every January. This allows us to sell stuff on public internet auction called Gov Deals. There's some requirements in the Ohio Revised Code. You can see there's a cited code of ORC 72115. It says there's some things we have to do. We have to set competitive bids based on what other people are selling things for, have to be up for at least 10 days. We have to have signs in our lobbies that say we sell things on Gov Deals. And once a year, you have to pass a resolution to let me do it for this year. So please.
Okay, I'd like to have a motion and a second to authorize the health commissioner to sell unneeded and obsolete and unfit property by internet auction. Second. Any questions? Ms. Hackathorn?
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. DeGuzman,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson.
Yes.
Okay, moving to Oprah's conversion plan. Mr. Cook.
There are 2 pages on your iPads that are for this item on the agenda. The first page is our sick and vacation leave buyout conversion policy. This has been in place for a number of years. The revised code and administrative code allow us to do this through the Ohio Public Employees Retirement System, OPRS. And this allows us to pay out leave when employees meet certain criteria for how much they accrued, didn't use, and their balances. So under our policy, in accordance with the law, they can convert up to 48 hours of sick leave, 40 hours of vacation leave from the previous year, as long as they meet some of those criteria that are in here. The second page is new this year. It lets you take a look at how many people are participating. So it's a total of 23 employees have elected to participate this year. Total number of hours of sick leave being converted is 1,044. Vacation leave, 313.25 hours of vacation. And total leave liability to get off the books is just under $45,000. People are paid at their previous year's rate because that's when they accrued it. And we had budgeted $50,000, so we came in just under budget, which is always good. Happy to ask if you have any questions about the policy itself or the conversion.
So it's a full payout. I mean, so if they make $20 an hour, it's a $20. It's not a percentage of that. Okay.
It was about this amount last year. We used around $45,000 last year too.
Just out of curiosity, what is how many employees are eligible to do that? And then 23 take advantage of it?
How many declined?
There was 27, so I think we had three decline.
I'm asking for a motion and a second to approve the sick leave and vacation leave buyout plan for 2026.
So move. Second.
Any additional questions? Ms. Hackathorn?
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt.
Yes.
Top of salary range adjustment, Mr. Cook.
So continuing with things that we do once a year, when we have a cost of living adjustment, we always look to see if we have anybody at the top of the pay range. We had a couple of people this year when we processed our 3% cost of living adjustment for this year. So what we'd like to do is move that top of the pay range for those folks by 3% so they can get that cost of living adjustment.
Okay, we have a motion before us to authorize the health commissioner to raise the top of the pay range for those 2 positions.
Yes. Approve. Or whatever.
No
move.
It's a motion.
Second.
All right, any questions? Okay, Ms. Hackathorn, roll call.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes,
Ms. Johnson.
Yes.
that's a fine thing you do there. Okay, then and now approvals, Mr. Cook.
This is not a candy, like a now and later, but the then and now approval is something that we do every year. Did you find that
And
fun?
now our laters.
Now and later?
I don't know.
Now and later. You remember that candy? Then and now? Okay, I guess you're all confused now. All right, so then and now approvals. This is a blanket approval. We did this last February. We just moved it back so we can do it in January. This goes back to the 1st, goes through the end of the year. The auditor's office asked us to do this. A then and now basically allows us to pay bills with invoices, usually at the beginning of the year, because we don't have purchase orders open yet. So we need something, we buy it, we get an invoice, it's got an invoice that's after the date of the purchase order being open, so that allows us to pay those bills. It's a blanket for the entire year. We provide this resolution to the auditor and they're good with all the then and nows that we do, or now and laters or whatever.
Good and plenty.
Yeah.
All right. So we're asking for a motion and a second to approve the payment of bills for the now or later, and then plenty.
So moved.
Second.
Is there any discussion? Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson,
Yes.
Dr. DeGuzman,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Yes. Position upgrade. Ms. Taylor.
Yeah, so I was just asking for a position upgrade for Miss Anita Schilling. She's a public health nurse 1 right now. She's been with us since July of 2024, and she right now is only one of 2 of our full-time immunization nurses, so she's carrying a heavy load right now. So I would love to get her position upgraded to a PHN 2.
So we're asking for a motion and a second to approve the position upgrade of Ms. Schilling effective January 19th, 2026.
So moved.
Second.
Are there any questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore.
Yes. Staffing changes, Ms. Hackathorn.
Thank you. You can see we did have a promotion. We had an exciting new hire as a home visitor, but then sadly a resignation next week. So, and they may talk more about that. And other than that, we have,
So I'm asking for a motion and a second to appoint new hires to the Public Health Services as recommended by the Health Commissioner, hired December 18th, 2025 through January 15th, 2026.
So moved. Second.
All right, any questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Robinette,
Yes.
Dr. DeGuzman,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Maybe right along. Financial reports. Mr. Jeff.
All right, vouchers first, 9 pages. And it wasn't that big of a month, but that's about as small as we get. Total for the month, just under $352,000. I would never downplay that amount of money, but most of them are not huge transactions. One of the biggest is our health insurance for the month. We finally paid for the paving project out front. That bill finally came through. Our water pollution, that was an in and out. We also had a donation for about $38,500 that we made to Rocking Horse Center. It was a pass through. That was money given to us last January that we pushed through to Rocking Horse. So it looks like some larger expenditures, but a lot of them were donations that we received.
Thank you. So we have a motion, asking for a motion and a second to approve the expenses, vouchers, for December 2025.
So moved. Second.
Any questions? Ms. Hackathorn, roll call, please.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. Johnson,
Yes.
Dr. DeGuzman.
Yes.
Mr. Jeff? Transfers,
It's in there, Greg.
transfers and.
No, I mean the unbudgeted part.
Is it in the packet?
I
It's
didn't,
not in the packet.
no, I don't see it.
Okay.
Talk through it.
I can talk about it. On the cash basis report, which is in the packet right after the 9 pages of vouchers. If you'll recall last month, I told you it was against the law for us to finish with any of these funds in the red. And if you're looking at the color version of it, and you look at the far right column of that cash basis report, you'll see that 3 of them are, by a grand total of about $1,200 between the 3 of them. So what we are asking for are unbudgeted transfers in those amounts, 6431 for account 8230, adolescent health, $986.14 for fund 8264, preconception health and wellness, and $130 for fund 8266, the COVID-19 bridge vaccination fund, and to bring them out of the red.
Okay, so we have before the board, I'm asking for a motion and a second to approve the unbudgeted transfers as presented, $64, $986, and $130.
So moved.
Second.
Are there any questions?
How do you decide where to pull it from?
It's gonna come out of our general fund because those are unrestricted dollars.
Great question.
Yep.
Okay. Any additional questions? Ms. Hackathorn, roll call please.
Mr. Griffith,
Yes.
Dr. DeGuzman,
Yes.
Mr. Adamson,
Yes.
Ms. Johnson.
Yes.
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt.
Yes.
Monthly budget, Mr. Jeff.
Sad but true, this may be the last month of the sheet of many colors. I know I've grown quite fond of it, and I really like the part that Mr. Cook does most of the heavy lifting on it. That's a nice feature for me. But there is an awful lot of information to process on here. I am planning on taking to our core team this month some different ways to present this kind of information to you. Based on what they say, I will bring you some options next month and let you take a look at them and basically tell me what's important to you. What do you want to see every month? Right, so you have a good feeling when you leave here of the financial position of the health department. As far as the report goes, as far as that piece goes, we just closed out the fiscal year. We put a little over $1 million in the bank. We're going to use a lot of that this coming year, but I feel good about where the health department is today.
So this says no action. However, I do love this report.
Do you?
Yes, I do. This is like.
Chris, would you like to comment?
And we like it.
One last time felt good, Valerie. I appreciate that. But I've already seen some of the previews of what he's gonna take to core, and 2 thumbs up.
Okay,
Seriously.
all right.
It's good.
Put you to rest. Okay, all right. Public health team reports. Jayla, you know about this report, don't we?
Yeah.
Okay. All right, environmental health. Ms. Zibby.
Thank you. Besides all the numbers of inspections that you can see we did in our monthly report, I'd just like to highlight that January is National Radon Action Month. Radon is a gas you can't see, smell, or taste, but it could be present at dangerous levels in your homes. Radon is a natural occurring radioactive gas, and it can enter homes through cracks, foundations, and pipes. It is the leading cause of lung cancer deaths among non-smokers in America and claims about 21,000 Americans' lives each year. Exposure to radon is preventable, and testing radon levels in your home can help prevent unnecessary exposure. Testing of homes is typically recommended in the wintertime because that's when houses are closed up, and so the radon gas builds up easier when air is not moving through the home. The good news is that if you get a detection of high radon, there are things that can be done, systems that can be installed in your house to help pull that radon out to the outside and help protect yourself and your family. So if anyone's interested, wants to have their home tested for radon, it's a nice little kit that we can get ordered from the State Department of Health. So I just wanted to bring that to your attention and make you know that radon is very dangerous and is present here locally.
So does that go down for our education? Because that was very
You
important.
can drag it out for a few
So I
more
do
minutes.
have a question.
Okay.
So I
I'll
have,
do my
I do
best
have
to
a
answer.
question about radon. Is it usually in like basements or lower levels?
That's typically where it is because
Because
it's
it's a
natural.
heavier,
It's naturally occurring in the soils.
okay.
And like more out towards the east side of Columbus, some of your more natural rocks formations. So that's typically where you see it, is in those basements. But they do recommend when you're testing that you do test in areas of your house where you spend a decent amount of time.
So you said there are kits available, will the public be able to get those for free?
There typically is not a cost for them.
Is there a certain area in Springfield or Clark County that might have it?
Not that
Kind
I'm
of like in,
aware
I
of.
know Hilliard area, they said,
Mhm.
you know,
I
radon
am
is
not
most
aware
prevalent.
of an area more.
Maybe I can give you just personal. So I've lived in my current home for 12, 14 years. When I moved there, I did 3 tests, staggered them out over a couple months because I was shocked when the first one was over 100 picocuries per liter. That's high. Action level is 5
Oh,
Is that on
picocuries
the
per
main
liter.
level or?
No, it was
lower
basement. And we have a finished basement, so we do spend a lot of
Yeah.
time down there.
Yeah.
And so we had a radon mitigation system installed. I don't know what the costs are now, it was a long time ago, but it was just over $1,000. Now, I know that that's still a lot of money, but if you think about all of your home improvements and investment in your health, that's a bargain. I can tell you in the years that I've had it, so over 10 years, I've only had to do one thing. I replaced the motor once. And typically they get 5 to 7 years. I got almost 9 out of mine. I did it last year. Ordered it on Amazon and replaced it myself in about 20 minutes.
Huh.
So,
So and I don't, know, the recommendation would be if someone's buying a home
A lot
that
of
has a
times-
basement.
a lot of times that's part of the
And
transaction.
Of a
Yeah,
home
I know I-
inspection.
In a previous home, we've had that mint had radon and
Yeah.
the seller paid for the mitigation system, so. But, yeah, you don't,
Or also when you're building a home, work with your builder on installing at least the components. So they're already there and all you have to do is
attach.
hook it up if needed, after you're moved in.
Good to know.
That's good to know. Okay.
Very informative.
It doesn't.
How many more minutes?
All right, nursing and studies, Ms. Cheyenne.
Yeah, so, in, I think it was like late December, early, well, next would have been in January, the CDC, I don't know if you guys have seen the news, has changed their vaccine recommendation. And so that's kind of had us spinning for a little bit. So what we have changed, or what they had changed, was hepatitis A, hepatitis B, rotavirus, meningococcal, and influenza. And the changing in that is from routinely recommended for all children to what they're calling shared clinical decision-making. Most of them have a criteria for when that they would be recommended. Like hepatitis B is really only recommended for those with positive mothers. And then the rest are just mainly like already ill children. What they've switched them to is that shared clinical decision-making, and this is where language matters. So what that means is that the insurance companies do still have to cover them. So if they come in and they want to be vaccinated against these, thankfully, they can still get that coverage through their insurance for now. But it's still no longer routinely recommended per CDC. Now, what you guys have there is the American Academy of Pediatrics. They are appalled by this, and they are standing by the recommended schedule that we had. They are not changing this. There's a few reasons for that, which we are going to align ourselves with here at the Clark County. One of them is that CDC changed their recommendations, but they didn't really go through the right channels, right? They typically go through a governing body, the ACIP, they get evidence, they base their judgment off of that, and then it goes back to the CDC for approval. All of that was bypassed, which has only ever been done one time before, and that was in the spring when they changed their COVID recommendations for kiddos and adults and pregnant women. Before that, that had never happened. It always goes through regulating bodies to look at evidence before they change those recommendations. Another reason why that schedule is so important is that just because they changed their recommendation, Ohio laws have not changed. So to say that hepatitis B is no longer recommended, but it's legally required for school is incredibly confusing to parents. So the two that are affected for the schools is the meningococcal, which right now is a requirement going into the 7th grade and going in to the 12th grade, and then hepatitis B, which is a requirement going into kindergarten. Typically, the routine schedule, you're done with those vaccines by the time you're a year old, so that's not an issue, but going into kindergarten, that's a recommendation or a requirement for school. And then also in Ohio, hepatitis A is not required for school, but it is required for anybody going into daycares and Head Starts. So that is still a requirement for a large population. So it's just incredibly confusing when you look at recommendations versus what are requirements. So for here, we are going to align with the American Academy of Pediatrics until there are further changes. Unfortunately, we have gotten no guidance from ODH. I think it's because they probably found out about it when it was tweeted and on the news, just like we all did. They usually never really get a heads up with these things, especially if it didn't go through that right channel. There was really no time for anybody to get recommendations. So moving forward for now, until we hear new things, we will be aligning with the American Academy of Pediatrics.
Thank you very much. Are there any questions for Ms. Taylor?
So is this the previous?
So it does say 2025, but only because they haven't came out with the 2026. So their schedule will not change. So that one is technically the previous, but that's still going to be the American Academy of Pediatrics schedule.
I thought they had changed the COVID because the FDA had brought out concerns of the pericarditis and myocarditis.
CDC may have, but they did not, the American Academy of Pediatrics. So what you have there is not the CDC. Although they have not released an updated version of theirs, looks very, very similar to that one, but they haven't released a 2026 one of that one either.
Okay. And then when you say requirements for like school and that,
Yes.
is it also there in the Ohio Revised Code? Parents can also fill out an exemption if they don't want to?
Yes, that has not changed at all. That's always been a thing. So for most, there's two exemptions. One is for religious or just beliefs. You can sign an exemption for that, and then there's a medical exemption as well. So say a kiddo has had chickenpox in the past, they do not need to be vaccinated, or measles, mumps, or rubella. Now those three you do have to have titers. You have to show proof of that, but chickenpox can just be a parent saying they've had that in the past. But yes, no changes to that. That's always been a thing.
Okay. But so are parents informed of that?
Yeah, I
Or
believe
they
so.
told? Okay.
Yeah, the school is the one who we don't do anything with exemptions because we don't mandate anything
Right.
either here.
Okay.
So the school is the one that would.
Because I know when I've looked on websites previously for schools before, they tell you what's required, but there's never anything
Oh,
mentioned
they
that
don't have
you
that?
can do an exemption if you'd like.
Oh, now when they come to us, if they had questions about that, we're always transparent.
Okay.
And even with this, we will be transparent. If they say, like, we are going to keep with those recommendations, but if they said, well, see, we would absolutely, like, this is what CDC says, as their recommendation. So we're as transparent as possible when it comes to this.
This week I was asked to review one school's immunization policy, and it had those exemptions in there. So if you look at the school, it may not be on the website, but if you ask to
Right.
look at the school's policies, which are public record,
Right.
almost guaranteed that they'll have that in there.
Okay.
Any additional questions? Thank you very much. Early childhood, Ms. Lambert.
Thank you. Just a couple of things this evening. First is, I know I mentioned that we had a retirement of a supervisor last month. So Ms. DeWitt retired at the end of December. And Tony Perez moved from the home visiting position into the supervisor position. She's done a really nice job with that transition. So I wanted to mention that. And the second thing, I just wanted to mention something about Help Me Grow. So Help Me Grow is designed to provide support for some families in our community to enhance their development at home. The program is also built on the premise that recognizes that the most of the wonderful development of a child brains happens before 5, so before they hit kindergarten. So one of the things that we work with families is to start early bonding with their babies using books. We know that children birth to 5 who are read 5 books per day hear 1.4 million words more than kiddos who are not read to. That's a lot. Also, we know that low-income families, those are the ones that we target and Help Me Grow, they're hearing 1/3 less words by kindergarten than the middle and upper SES classmates. 1/3 less. So when they hit kindergarten, they're already quite behind, and we want to try to affect that stat. So soon after we meet a family, we're linking them, of course, to the Dolly Parton Imagination Library. And I also try to squirrel away enough funds to try to take one book a month. So we try to take one book out a month. But the most important thing we do is that we help the family come up with a plan on how to read with their baby. So, and we want them to encourage them to have it be part of the routine, because some families don't have routines much. And we really want families to understand that that is so wonderful for their child to have a routine, because it helps them feel safe. And then we also want to educate them to start prenatally, because in utero, babies can hear, they find at 17 weeks, and they can hear well at 26 weeks, so which is quite miraculous. And then once baby comes, we want them to continue to read. And even though that babies can't understand the words, they're learning the parent's voice. They're recognizing that all the attention's on them, which of course what babies crave. And this enhances the attachment and bonding. So in the reading plan, we want them to pick simple books, use sturdy ones, and actually I encourage them on how to read to baby. Sit with baby, cuddle with baby, change your inflection of your voice, and then reminding them that the baby doesn't matter if they can't read well, just that they read. They spend that time with them. So, and then when we go to visit the next week or the next time that we go to visit, then we're asking them, did you, how many days since we were here, did you sing to baby, read to baby, talk to baby? And we hope that they answer 7, that they did every day. But if they didn't answer 7, then we try to work with them, what can we do to increase that number? So I just think that is an interesting thing that we try to do in Healthy Grow. Yeah.
Wonderful.
And then we track that data, and it's one of our outcomes. How often does a parent read to baby?
I know last meeting, there were issues with cribs. Do you have any
Yes.
update with
Yeah,
that?
so I was able to find enough to kind of get us through. I think I took one last one, last week before they came. They did finally come.
Oh, good.
And we did have some families that had to wait a little bit, but not too long. Were you gonna ask about that?
Well, I was
Okay.
gonna ask actually
Yeah.
about the books. Do we
Okay,
have
yes.
books in other languages than other than?
We have them in Haitian Creole and Spanish. Yeah, we don't have a big amount, but yeah, we do have them in Haitian Creole and Spanish, yeah. Yeah, I'm just always gonna run out, because I'm gonna run out of funds, but then somehow I find some so that we can get books again, so, I think we put the last ones out that I have money for, but you never know. I might come up with some.
Thank you very much.
Yeah, thank
I think
you.
that's wonderful. Women, infant, and children, Ms. Schaefer.
Thank you. On the report, I have an item to note. It was a correction that was made to last month's numbers for the hospital visits located at the bottom. The numbers of recertification and certification visits were inverted for November, and this has been updated on this month's report and identified with the asterisks. So that was the one thing I wanted to mention, that there was a correction. But that was all I had for this evening. Thank you.
Thank you. Any questions for Ms. Schaefer? Okay. House planning.
Yes,
Ms. Grace.
awesome. So you have the packet on your iPads. If you have any questions, I'd be happy to answer those. But 2 things I wanted to mention was first, I believe at the last month's meeting, I mentioned we were in the interview process for a new epidemiologist. On the new employee hired sheet, you'll see Kim Wise was hired as our epidemiologist, so we're excited to have her. Kim actually has been here almost a year, and she worked with Cheyenne in the immunization program. She's not a nurse, she was a public health specialist, was the title? Yeah. But she has her master's in public health, specifically in epidemiology, so she was excited for the opportunity. She has been slowly transitioning into that role since right before Christmas, and so there's a lot to learn. It's kind of like a fire hose, but she's doing great. And slow and steady wins the race, but we're excited to have Kim, and I apologize to Cheyenne.
She's an amazing worker, but she is so smart. We were not utilizing her at Best Village, so I really encourage her to put in for that epidemiologist.
Yeah.
She's gonna do great.
We're excited to have her on the epi side. So wanted to mention that. And then I also wanted to mention that you have a colorful flyer in your packet. Believe it or not, Minority Healthcare will be here before we know it. So you have a save the date for that. It will be April 25th at Hayward Middle School again from 10 to 1. So we are starting the planning process and getting vendors and things. So we're excited again and just wanted to make sure you all were aware. Thank you.
Thank you. Any questions for Gracie? Okay. Legislative updates. Commissioner comments.
Well, if we want to keep this to an hour, I got about 12, 13 minutes. So. I knew you were looking at me. All right.
Now and then.
The state legislature is still out. They will be returning soon, so hasn't been a lot of action there, obviously. But I do have a couple of things of national interest that I want to highlight and a couple of local as well. I do want to underscore some of the things that Shane was talking about with the us aligning with the AAP immunization schedule. Dr. Thompson, thank you. You offered your expertise the last couple of weeks in this area too. As our medical director, appreciate that. Gracie and I met with the superintendents of the schools last Friday, like we typically do every month. And we talked through this a little bit, just trying to clarify for them, because there's confusion for them too, about what the fact that attendance requirements and immunizations you need haven't changed with the schedule because it's in law. And so they were very appreciative of that. And also just wanted to mention too, that when this change was made, just again, highlight what Cheyenne said, that no new evidence was brought forward for this change. It's going to cause confusion. It already is causing confusion. It's just unfortunate it went this way. But it's going to cost the healthcare system more. It's going to cost individuals more in premiums. As we're going to see diseases come back that we shouldn't be seeing. So just again, appreciate the staff's efforts there in education for our schools as well, so they're clear on what's going on. So speaking of national things that have happened in the last couple of weeks, new dietary guidelines, right? So you saw the pyramid was flipped, I guess is the best way to describe that. So let's first highlight some good things. First of all, recommendation for more fruits and vegetables. Love it. Couldn't be more behind it. Another good thing, decreased sugars, decreased refined foods, decreased processed foods, all great, love it. Alignment with everything that public health believes in. Now the bad stuff, right? So the war on saturated fat is over. Ridiculous and dumb. Sorry, I'm just gonna say it. Red meat is okay in any amount that you want, not smart, okay? Cardiovascular disease is still a concern. So don't like that at all. From a public health standpoint, don't love that you need to soak everything in beef tallow and butter and everything too. That's a problem. It's still going to be a problem. Also didn't love the fact that alcohol, the restrictions, recommendations for men and women has been released, and alcohol was called a social lubricant that has a necessary place in our community. Not exactly what you expect to hear from HHS and our folks that are supposed to be experts at the federal level. So didn't like that part of it, but did like the fruits, veggies, sugars, refined, processed part of it. So what's the impact? Let's be very honest, the average American is probably not going to make a lot of changes. So what is it really impacting? It impacts our programs. It is going to have an impact on WIC. It's going to have an impact on SNAP, food benefits, our school lunches. How quickly is that going to happen? Not quick. It's going to take a couple of years for all of this probably to trickle down into those benefit programs. But changes have been made, again, good, bad. I'm not going to forego the good. But the one thing that I highlighted under all this is no new science or data was presented for any of these changes, which seems to be a theme. Another item to bring to your attention, the U.S. House passed an extension for the enhanced ACA tax credits. It goes to the Senate now. This has been done before and it's been struck down in the Senate, but there's some hope because there was some bipartisan support for it in the House, so we have some hope. The Senate has not taken it up yet. It's probably going to be in the next couple of weeks to see if those tax credits will go through. It was a proposal to extend those ACA Obamacare era enhanced credits for the next 3 years. So we're hopeful to see where that's going to go at the federal level. Coming back down here to the local level, do you recall me talking about a natural plant called kratom? Remember I mentioned a couple months ago, there was a House Bill 587 here in Ohio was going to put restrictions on kratom, which is a natural plant that has hallucinogenic properties, opioid type properties. Governor DeWine, after our last meeting when I talked about this, signed an executive order to call it a Schedule I illegal drug. So that is in place. The Ohio Pharmacy Board is putting some rules to prop up his executive order. So that's in the process. I'm very excited to see that. So there will be a continued ban on that natural kratom here in Ohio as the Pharmacy Board works on that. Rural Health Transformation Grant, I mentioned that to you a couple of times. Excitement about money coming potentially to local health departments. Well, we're 0 for 2 at this point. So they put out 2 RFPs for sections of it. I told you that part of it was to prop up the rural health care workforce. An RFP was put out for that. It was called the Rural Health Workforce Pipeline Pathways Upskilling and Retention Grant as a sub-grant of this. Not for local health departments. It's going to be taken up by a college or university someplace in Ohio, I guarantee that. Then they put out a second RFP, and Gracie were like, is this ours? No, stay seated, public health. It's not for you yet. It's for pharmacies. So getting some pharmacies propped up in our rural health areas in Ohio. Supported, but not what we were hoping for here at the health department. So continue to watch these RFPs roll out as part of that bucket of money that's the Rural Health Transformation Grant that still, with the cuts that happened in the past year, is still a net loss for communities, but it's being billed as a great thing. But we'll take it if we can get it. And then finally, I wanted to mention another item that we have started to become a part of here at the health department. It's called the Midwest Collaborative Resilience Center. Boy, what is that? All right. So this is something that Central State has created a grant program and are going out to talk about groundwater vulnerability and resilience for both Montgomery, Greene, and Clark counties. Their focus is on 4 watersheds in this area: Mud Run, Huffman Dam, Mad River, Jackson Creek, Mad River, and then Dry Lake Run, which is Mud Creek as well. So the focus of this grant program is public education, groundwater vulnerability, with a lot of focus on nitrates. So we are part of this collaborative. What are we doing here at the health department? Not sure yet, because we've just had one meeting so far, but we are a part of this. They've asked experts in this area to lend their expertise, and I'm going to be on it. Gracie's going to be on it. I'm going to invite you to start coming on these as well too, Zibby, to find out exactly what it means for our community. I think a lot of it's going to be educating homeowners about what nitrates are and the hazards that they present in groundwater, whether they're municipal water supplies or private water wells. So we're excited about our place in that grant by Central State. I will stop. I know, are you looking at, I know, I'm almost there. I'm almost done. I know you're looking. I am done, unless there's any questions. I'm going to stop right here.
Okay. Are there any questions? Okay. Announcement that the board needs to elect officers for 2026. President and President Pro Tem, also known as Vice President. Now, the terms are for 1 year, and is there any nominations by the board for these 2 positions?
I nominate Valerie Moore.
I nominate Scott for Vice Chair.
Okay. I nominate you for President.
Yeah, I agree with that nomination. Both. Sounds like a good slate to me.
That's because you're having a week. Okay. Let's see. So we have nominations for both positions for the board. Is there any other discussion about that? Okay. Can I ask for a motion and second to adopt the nominations?
So moved. Second.
Okay. All right. If there is no discussion, can we vote on that now? Okay. Ms. Hartshorn.
Voice vote.
Voice. Oh, voice. Okay, I didn't see that word. Sorry. Can we have a voice vote? All in favor?
Aye.
All opposed? Okay, that motion carries.
Congratulations.
Oh, thank you. We're so excited. aren't we? We are so excited. And I'm so excited that it's not 7:00 yet. Okay. Is there any additional business? Then, okay, next regular meeting will be on February 19th, 2026, right here. Okay. And so now we're gonna adjourn. Can I get a motion in a second to adjourn?
So moved.
Second.
Okay. All right, can I have a voice vote to adjourn?
Aye.
Aye, aye, aye.
Aye.
Yeah.
Oh.
Just kidding, just kidding.
All right, we are adjourned. The rest is carried.
That didn't
Oh
make
my
sense.
God.